Hey, this is Greg from Big Bay Mornings on 99.7 Now, and I am back with my friend, board certified plastic surgeon, Dr. Bay.
Hey Greg, how you doing?
I am amazing, Dr. Bay. Hey, I wanted
Glad to
to
hear it.
talk to you about this. You are very transparent with your pricing. You have a pricing
Mhm.
tool right here on the website that people can find out how much something costs. Not everybody can pay for everything right up front. I mean,
Mhm.
you're not going to sit here and tell people, "Yeah, I can do this for next to nothing." And I don't want
Right.
my surgeon saying that, by the way.
Right.
um,
Right. Right.
s-
Cheap plastic surgery isn't good, and good plastic surgery isn't cheap.
No. So tell me some options that people have. Maybe I can't roll out five, six, seven, $10,000 just right off the bat, but I want to get a
Right.
procedure done that costs that.
Yeah, so it's a tough question because we don't want people overextending themselves, but there are definitely ways of financing these operations through different services. We don't actually do any. And people ask all the time, do we do in-house financing? We don't do in-house financing, meaning that we won't do your operation for nothing up front and then you pay us back over time. We don't do that, but we do use some finance. You'd be
Yeah.
surprised how many people ask that.
Well, and by the way,
But
I don't do that for the radio station either. I don't say I'll work for
right,
a couple
exactly.
months and you pay me later. So I get that. I
Right.
don't do that either, Dr. Bay.
So that's what I'm hoping is once the utility company says, "Oh, we'll just give you the
Yeah,
electricity for free and you can
absolutely.
pay us next year," that's when I'll start doing it. But for now, what we do is that we use some third-party financing companies, like we use Care Credit, which a lot of people use, not just for cosmetic
Yeah.
procedures, but if you have a high deductible health plan and you got to pay out of pocket for medically necessary services, people use Care Credit for that. They use it for dental work. So we use Care Credit. We use another company called Alpheon Credit. There's Prosper Healthcare Lending. There's several of them out there, and they do things different ways as far as how they pay. But the idea is that we get paid up front for the service from that company, and then the patient pays them back. So, like Care Credit, for example, they will pay pay the Care Credit back. The consumer will pay Care Credit back, monthly for a certain period of time. And the thing people need to keep in mind is there are options. There are some options like you can do 6 months no interest, where Care Credit pays us everything, and then if you pay Care Credit back within that 6 month period, you have to pay them the full amount, but no interest. That's pretty awesome. But
That is
just be
awesome.
sure
That's
that
like cash. Yeah.
it's like cash, but just be sure that you're going to be able to pay it back within that
Exactly.
6 months, because if not, then they are going to start to add interest. And the interest is like 26%. It's like very high. Now,
Oh, I
whether
see.
that's
I see. I see you do financial advice too, Dr. Bay. So
exactly,
you're a
exactly.
financial advisor, and yeah, I mean
but
a lot of
but
people
please.
don't understand the interest rates and stuff like that. So you have to do your research.
Right, and that you got to keep in mind, how do these companies make money? They don't make money by paying them back interest free in 6 months. They make money by people not being able to pay them back in 6 months interest free, and then they have to pay a seventh and eighth month and a ninth month with that 20% interest rate. So, of course, whatever advice I'm providing, make sure you clear it with an accountant first or your tax advisor. But the other thing to keep in mind is like, okay, well, so you're thinking, okay, you know what, I can't afford it 6 months. I can't pay it all off in 6 months. So I don't want to be stuck paying some usurious interest rate for that after those 6 months. So the other option you might think is like, well, I'll pay it off over 5 years, or I'll pay it off over 6 years. And they do have plans like that. But keep in mind, those interest rates are pretty high too. Maybe they're not as high as 26%, but they're maybe like 14% or something like that. So they do get kind of high if you're not going to pay them off within like a year or two. So just keep that in mind. Be safe. Read the fine print. The fine print is there. They're not trying to hide it from you. They have
Yeah.
actually, I think by law, they've had to make the fine print bigger. It can't be as fine. It has to be bigger and easier to read. Um, the other thing the state of California has done is that we can't sign you up for Care Credit. Like would be the way it could be done in the past, and it could be done honestly, where we would sign the patient up for Care Credit. They would like give us their information, and we would physically sign them up online. Now we no longer can do that. They have to physically log in and sign up for themselves, because obviously some doctors maybe, or some institutions, were signing people up without their knowledge. So that's why you can't do that anymore. We never did that, of course. But anyway, read the print, know what you're getting yourself into. And a lot of people, you'd be surprised. I mean, even if your credit score is not awesome, people are still getting approved
Get
by
it.
these different companies, and they're getting the procedure and hopefully paying back the company to keep the company whole, so they don't turn them over to collections.
All right. And what about crypto coin? Do you take crypto coin? That's a big thing.
We do
these
actually.
days.
You gotta.
What?
Yeah, you gotta stay up with the
Okay.
times. Yeah, we take Bitcoin, Ethereum, Litecoin, Dogecoin.
Wow, this is blowing my mind.
I don't know that we could take XRP right now. I think that's like tied up in litigation in the SEC or whatever. But yeah, we do take crypto coin if people are interested in paying that way. The trick is to get paid by that crypto coin and then cash it out immediately because the price fluctuates.
Yeah,
so
you
much
never
that-
know.
Yeah, somebody could pay you when it's $10,000, and then when you cash it in, it's $8,000. You just lost $2,000 on the operation. But
there you go.
but
So
that's- but
So you
that's
got to
the
work
risk.
out your finances on your end too.
Exactly. That is true. That is true.
All right. Well, thanks, Dr. Bay. And if you want pricing, it's right here on the website. Everything is transparent. You can book appointments. You can call to ask questions. You can email to ask questions. Or probably the easiest way is to reach out on social media.
Yeah. You can reach us on TikTok, Snapchat, Instagram at Real Dr. Bay, RealDrBae. You're a great spokesperson, Greg. I might pay you to do this.
Oh, you should. In crypto. I'll take Bitcoin.
Fair enough.